Welcome to episode 3 of the New Resilience podcast, where we share stories, lessons, and wisdom from the field, right from outreach, admissions, and really the bones of building a business. We have David Nissen with us today, and we'll just jump right in.
Sounds good.
All right. So, David, I think a lot of people here watching might know you, but would you mind sort of walking us through how you got it started in the behavioral health space? A brief overview of like what your journey has been like.
Sure, absolutely. I started as a night shift mental health tech.
Hmm.
I was working my way through college. I was in Athens, Georgia,
Hmm.
and needed a job. And
Okay.
started working night shifts in a psych hospital, and have been in the business ever since.
Wow.
Yeah,
So, how many years has that been?
long before you were born. I started in 1986.
1986. All right.
Yep. Yeah, and then I worked in virtually every level of a psych hospital
Okay.
over the years. So
Okay.
went from direct care mental health tech stuff, spent 15 or 16 years in intake,
Okay.
working on crisis intervention, intake admissions, worked my way into marketing, and then to a CEO level. So I
Wow.
ran psychiatric hospitals in various states, and it was a fun ride.
Okay. So this was corporate all the way through.
That's correct. Yeah, they're all for-profit corporations. Yeah.
Okay,
Yeah.
got it. And then, did you then decide to sort of like jump into something of your own, or like was corporate not like?
It's
Tell us what that was like.
It's probably a similar story to a lot of people.
Yeah,
A little burned out on the corporate culture,
yeah.
and in 2001, formed a company called Pasadena Villa with a couple of partners of
Mm-hmm.
mine, and we opened in 2002,
Mm-hmm.
providing long-term residential care for adults
Got it.
with serious mental illness, a lot of thought disorders,
Yeah,
really clinically complex clients,
right.
and I didn't think about growing it from the onset. We just wanted to
Mm-hmm.
provide good care in a small program,
Mm-hmm.
and it just grew. We filled a need. Um,
Yeah,
People trusted us,
yeah,
and then the business grew, and we expanded to another program in Tennessee,
right.
and
Awesome.
and it was fun. Took a lot of the lessons learned in the corporate world and tried to apply
Yeah.
it to our business. But we sold that in 2015.
Wow. Congratulations.
Yeah,
That's
thank you.
that's awesome. I did want to like when you think about entrepreneurship, it's obviously a hard life, like taking a lot of risk on your own. Especially in a field like behavioral health, which has its own challenges. Was there something in your background, like your past life, people that you grew up with, where there was a sense of meaning that was attached to it? Like, how'd you decide to sort of get into it?
I think it was more knowing we could do it well.
Okay.
Uh, we weren't naive to think, oh, we're better than everybody
Sure.
else. But you get to a point where you've provided care, we've run big teams with hundreds of employees,
Mm-hmm.
and we just wanted to do something we had more impact
Hmm.
on, right? We
And you
wanted,
felt that was missing in the corporate setup? Was that?
oh, no question.
Yeah.
Yeah, yeah. It was, you couldn't be creative
Okay.
and think on your feet.
Yeah.
There was but there's a time and place for everything.
Sure.
And I'm not saying it was bad leadership. It
Yeah.
wasn't. I got to a point where that wasn't where I wanted to be.
Yeah. Like, reason why I asked that is because like some of the people who are watching or listening could be thinking about starting out on their own, and it kind of goes back to the idea of you identified a gap that was potentially there and sort of said like, here's something that where I think there's a need for people, real people out there, and I'm going to go do it.
That's a good point. That's a
Right.
good point. You want to have some kind of niche,
Yeah.
some kind of expertise. You don't want to just be selling the same thing and saying you're
Right.
doing it better.
Right. Right.
And I felt that's what we had.
Yeah.
And most people that start a business in behavioral health care think that they've got something new and different and
Sure.
vibrant, and maybe it's a different approach to providing care.
Yeah.
And some are pretty creative and innovative, and,
Okay.
and some are kind of more the same, just packaged different.
Mm-hmm.
So I think I would just really caution people on the front end to really identify how you would be different
Mm.
from what people are already doing.
If you
Yeah.
if you don't mind, I think that's probably like a pretty good area for people to understand how to differentiate, because we keep hearing from people where there's so many players in there, it's hard to differentiate. and get people, even though they're well-meaning people, it's hard to get in front of people. So how did you crack it? Like, how did you think about how to differentiate? If you could go a little deeper into that.
We may have been at the right place in the right time,
Sure.
but we early on tried to think of those clients who were not a good fit for most other programs.
Is it clinically
Clinic-
pretty acute? Was
yes, yes. It was those with thought disorders and pretty persistent mental illness that just wouldn't be a good fit in a lot of other programs. And
Okay.
they end up in other treatment programs or hospitals for various reasons, and they get identified as being not a good fit.
Right.
And we wanted to be their go-to place, and it was
Yeah.
and we filled a need in that regard.
Right. Right.
I think that gap has kind of filled over the years. There are
Sure.
a lot of people providing really good work in that field,
Sure.
but that was our differentiator.
Got it.
Is
Got it.
you get a client that's going to bomb out of your program before you kick them out. Let's see if
Yeah.
they're a good fit with us, and that
Right.
they often were.
Right.
Yeah.
I mean, I'm fascinated by it, but we are trying to build our own startup at New Resilience, and one thing that we always try to think about is any market that you go into, there's always players in there. So, did you think about validation in some sense because you identified the gap, like before you took the leap? Was there some ways that you were thinking about, oh, this is an experiment that I do, or like some data that I collect, or this is this, so that you're very sure of this going in, or it's more like you have faith, take the leap, and kind of go for it.
You have to have faith,
Yes.
right? Starting a business, you make a lot of assumptions,
Sure.
and some are going to be pretty accurate,
Yeah.
and some are going to be way off,
Yeah.
right? And you hope that those that are pretty accurate or more, you
Yeah.
have more of those,
Yeah.
right?
Yeah.
So you make a lot of assumptions, and for us, our validation was not getting a referral from a professional referral source or one of our key partners. It's that second and third and fourth and fifth. It's those recurring referrals from key referral sources that kind of validated that we were doing well. That our customers were getting good care, our clients were getting good care, the families were getting good communication. The referral source was part of the process.
Yeah.
And so our confirmation came from that. And we paid a lot of attention on developing relationships that could produce referrals over the long term, rather than continuously trying to find new referral sources, if that makes sense.
Yeah. No. Yeah. 100%.
Yeah.
What makes a good relationship, you think, with a referral source? Like, because there's people who are like on the outreach side, clinical side, trying to like do that.
Well, a lot of people have different tactics.
Sure.
So there's no
What worked for you?
no one size
Yeah.
fits all.
Yeah.
For us, it was just humility and just excessive communication. We wanted the referral source to be a part of our process, and they couldn't be there every day. Couldn't be.
Yeah.
They're not part of the treatment team.
Yeah.
But we wanted no surprises.
Yeah.
We wanted them to hear no surprises from the family or the client, and just engage them in the process. And for the most part, we did a pretty good job with that.
Okay. And was it a lot of communication that also helped, besides the clinical aspect of the program, that helped in trust?
Oh yeah. Excessive communication. And,
Okay.
And clinicians tend to not like that very much. They
Sure.
want to communicate with the client.
Right. They want to take care of the client.
And so is a constant evolution of training and guiding our clinicians to see that this communication piece it impacts our clinical care.
Yeah. Yeah.
I mean, there's a need. It's not just a sales job. It is.
Right.
It's important that we communicate with other treating professionals.
Yeah.
Right.
Yeah. No, I think you touched on a very important point where I think sometimes when, like, let's say people on the clinical side might not view it as important, but what you're trying to say is it is an important part, even though on the surface it might not seem so. It is a very important part of the entire support system that is around the client.
Right. And
right.
No, we can't provide good care in a vacuum.
Right.
We have to do it in communication with those that trust us and refer to us, and we refer back to them. But we also have to know that we can't do everything for everybody either, right? There are clients that aren't good fits for us, and we have to be able to make those meaningful referrals to other people.
Yeah.
And say, this is why they're not a good fit from us, but we think they're going to be a great fit for you. And it's a very reciprocal, collaborative partnership that we try to create.
Okay. Yeah, that's a lesson, I think, for like everyone who might be listening to this. I guess let's talk about the entrepreneurship journey a little more. So you went from corporate, you took the leap. Is something that I've identified. Great, this is going to work out. Did it work out exactly as you imagined it to be, or were there challenges along the way?
There are a lot of challenges. A lot
Pretty
of
easy, right? Like it's just
yeah,
like
yeah. It
boom,
was
boom, go.
simple. Oh yeah,
Yeah,
easy.
yeah,
A lot of challenges. A lot of
sure.
challenges. You know, you don't know what you don't know
Yeah,
sometimes. And it's funny as I talk to other people who have
yeah.
fairly new in the business, have started new programs.
Mm-hmm.
It brings back a lot of memories.
Hmm.
But when we start small,
Yeah,
it's scary and
yeah,
it's risky,
yeah.
but it is easier to run,
Sure.
right?
Okay.
As you start to grow and you
Yeah.
start to scale and you add more beds and more employees and
Mm-hmm.
then the demands for more relationships with referral sources, you know, yeah, it gets a lot more
Yeah.
complex. And and you don't really anticipate those growing pains, you
Hmm.
know, until you're in them.
Right.
And
Right.
then you know, we kept trying to somewhat anticipate what we were facing
Mm-hmm.
so we didn't get ourselves in crisis mode.
Got it.
We
Got
didn't
it.
want to avoid crisis management, right? It's just, you know, try to respond quickly to the marketplace, quickly to our data needs, to
Hmm.
our employee needs, and not feel like we're ever making decisions in haste or in a crisis.
Hmm. So when you think about like the challenges there, I think you touched on like a few things. There's data aspect, there's the operational aspect. If you were to sort of pick out, here's the top thing that like was always on mind, or like what kept you up at night when you were sort of starting a bit. I'm sure a lot of
Yeah,
things again,
yeah.
but it's hard to pick. But if you were to like, because again, people starting out, often that we see on the side of entrepreneurship is it's only glory stories that are shared,
Hmm.
where like someone makes it big and that's all you hear, and then I think it's very isolating as an entrepreneur to see, oh, is it just me who's facing challenges? I think it's very valuable to hear people who've been on the field talk about the challenges a lot more. So if you could
Yeah.
shed a bit of light on that.
A lot of challenges. You know, anybody that started a business, ran a business, you know, it's not 8 hour days. It's not 5 day weeks.
Right.
You know, it's 24/7.
Sure.
And it affects your family. You know,
Mm-hmm.
it affects your vacations. It affects your children. It
Right.
affects your spouses. And you know, you kind of have to be all in,
Mm-hmm.
and to a point where you've got the ability to surround yourself with good people
Mm-hmm.
who you can delegate to, and they can take on bigger pieces of it. But yeah, it was very very scary. You know, another thing I see in our field in particular,
Mm-hmm.
mental health addiction, in behavioral health, is that there are a lot of really brilliant people
Mm-hmm.
that care a lot about providing good care,
Right.
which is fantastic.
Right.
But because there's such expertise clinically and administratively, people really make a lot of decisions with their gut feeling.
Mm.
They have hunches, they have their intuition, and those are gained from a lot of successful experiences.
Sure.
But it's a really fast-paced marketplace. You
Mm.
know, it's changing so fast, and I, you know, wasn't long into our journey at Pasadena Villa where we realized that uh, we really needed to be collecting and making decisions based on more data,
Mm.
and that would be my point to virtually anybody who's thinking about entering our field or recently done so, is that we 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 can all make pretty good decisions sometimes with our gut and our intuition, you
Yeah.
know, just because of we feel like we know.
Yeah.
You know, a lot of times we just don't.
Okay.
We just don't know.
Yeah.
And those decisions can be very detrimental that you're making without good sound data.
Interesting.
Yeah.
Yeah. I mean, like we hear that. Is there an incident or like instance that comes to mind where, you talk about like the gut feeling versus actually taking the long view and looking actually at data and seeing the difference?
I wouldn't say there's a specific instance I can
Yeah.
give you, but I can tell you it's a series of many instances.
Hmm.
Um, and uh, you know, when you're looking at deploying money for your business
Sure.
development efforts, your marketing efforts, your referral development, your
Yeah.
professional partnerships, those are big commitments.
Hmm.
And we all in our field spend a lot of money on
Mhm.
that.
Yeah.
Whether it's conferences or different events or CEUs or just people hitting the street and cold calling.
Yeah.
Of course, the digital media side too. There's
Yeah.
money to be spent everywhere
Right.
on trying to acquire clients. And we talk about client acquisition costs and
Yeah.
what are we spending to really bring a new client into our
Yeah.
program? And a lot of people just don't know
Hmm.
what they're spending on and whether it's effective. So they're just trying to hit everything, and
Right.
and hopefully it works. And there's a lot of insight that you can only gain
Okay.
from looking at data.
Do you think it's because of inaccessibility of the data itself, or it's an education thing where people don't really value it as much? And
It's probably a little of both.
okay,
Um, yeah, there's an issue of if you're a clinician or a physician, you want to care for
mm-hmm.
people, you know, you don't want to rely on
Yeah,
data
yeah,
necessarily. But I will say this, if you're going to go in for a cold to a doctor,
yeah,
they could probably tell you pretty quickly
yeah,
what you have. But if you're going to go in for surgery,
yeah.
you better believe that surgeon has imaging and
Mm,
lab results and scans
interesting.
and x-rays
Yeah,
and all kinds of data, right?
yeah. To before you take a decision,
That's exactly right,
right,
right? And so when it comes to people going into treatment
right.
and spending their money or the insurance company paying for it, but the family committing to support somebody in treatment, that's a big step,
Mm,
right? It's a real big step.
yeah,
And for us to think that we can just intuitively know where we're going to
mm,
get those clients from
yeah, yeah.
is probably not a real accurate assumption.
Sure.
And so when you dig through data, you can really find these trends of where you may be spending money you shouldn't
Yeah,
be, and maybe
yeah.
other areas you should spend more.
Yeah, like we keep hearing about things where you said like cold calling, people go to conferences. Often they do not really know what the ROI is. They're kind of doing it because they have to. It's almost a given that they have to, but they don't really know and really don't ask the question
Sure.
a lot.
Yeah. Yeah. And even if they ask the question, they may not easily
Get the
be able,
answers.
right, to have the
Yeah,
data to make those decisions. Yeah.
got it.
Yeah.
Yeah. So when did you start? So cut back to again the entrepreneurship side where you're like starting to like build the team, build the systems, and starting to see, okay, I need just more data. Were there instances where did you finally get to build that system, or have you had experiences with systems before? Where like, okay, this is how, it should work, and any lessons from there?
Interestingly, uh, going back to when I first started in 1986,
Wow.
there was one of the companies I worked for had a tracking system for inquiries and admissions. So we could track every phone call, time to a referral source and we could sort it by category, by detail.
Mm-hmm.
And it was probably ahead of its time,
Hmm.
but I geeked out on that early, right? I loved it. I loved knowing exactly where our business was coming from,
Sure.
who we were referring out to,
Yeah.
and why people weren't admitting if they were not admitted. It was funny after that,
Yeah.
after I left that organization, the subsequent organizations weren't as refined in that,
Hmm.
even the big hospital companies.
Wow.
And then, of course, when we started our own business, we just used a variety of kind of off the shelf programs to
Right.
try to collect our data.
Yeah.
It's remarkably frustrating.
Yeah.
The outputs for me were never satisfactory.
Right.
So
Right.
I ended up for my whole time probably using multiple sources and collecting data from different
Yeah. Yeah.
places, right?
No, we keep
To put
hearing
them,
that.
yeah, and it happened up until the time we sold, I'm sure.
Yeah.
Yeah.
Yeah. Yeah. So,
Yeah.
so a system that was there in around 1986 spoiled you, and you just
That's
couldn't.
right. If they had today's technology, if
Yeah.
those people were still in the business, obviously,
Yeah.
with today's technology, it would be fantastic. Which is what I'm hoping New
Yeah.
Resilience will be, right?
Exactly.
Yeah, yeah,
Yeah. So I think
yeah.
that's where we are trying to come in, where we're trying to like put away, in some sense, those blind spots that people might have into their business, bring out those insights in a way so that they can understand really what's working, what's not working, what's the ROI on all of the things that you're doing, and bring it all together in a very easy and intuitive way. So,
Well, I love that, and I'll tell you, I've done a fair amount of independent consulting since
yeah,
we've sold Pasadena Villa with different treatment centers throughout the country, mental health and substance abuse, and boy, the stories are just the themes are just
similar.
similar, completely similar. And I'll go in and ask to provide me this information because
Yeah,
I'm doing my assessment of the
yeah.
organization in my consulting gig, and they can't provide it.
What
So it's
kind of
like,
questions do you ask? Like,
well,
let's go through that.
I really want to look at revenue per patient day per referral source,
Hmm.
not just
Yeah,
per admission,
yeah,
but per admission per source,
yeah,
right?
yeah,
Nobody can provide that. So I get a report from intake, a report for admissions. I get
yeah,
something from the controller or the CFO, and
yeah,
I'm putting all this stuff together, right?
yeah,
And it's remarkably frustrating.
Mm.
And in our field, a call or inquiry
Mm-hmm.
doesn't equal another call and inquiry. They're not all
Sure.
the same. And even a professional referent,
Mm.
right? Those referrals aren't all the same because
Mm-hmm.
they all convert at different rates.
Yeah.
And you could have your call center going bonkers with a
Yeah.
lot of media calls, and maybe you're converting 1.5% or 2% of those
Yeah.
to admissions,
So you're burning a lot of money.
burn a lot of money and a lot of resources for
Yeah.
sure. You know,
And that's why probably the customer acquisition costs are just going through the roof.
sure, yeah. And then if you look at that same data from certain segments of your referral partnerships,
Yeah.
you'll see some that are converting at 30, 40, 50%
Yeah.
per
So
referral.
you're much better off spending money there, but only if you knew.
Only if you knew. I'm not saying that you should change your approach. You
Yeah.
just know that that's what you're dealing with,
Yeah.
right? And so you're handling a lot of incoming volume on low conversion rate business.
Yeah.
And maybe that you're okay accepting that as part of the deal, right?
Right. Right. Right.
But very few places I consult with can even conceptualize making those decisions because they can't find the data.
Yeah. Yeah.
Yeah. Yeah.
So when you go into the consulting businesses, like I mean, in a previous life, I have been in consulting. We typically are not very popular with the people that you're going into because you're basically coming in and saying, "Let me tell you how to do your job," which you've done for 20, 25 years. Has that has that ever come up or like?
Yeah. Oh, of course. Yeah.
Yeah.
Yeah. Yeah. Yeah. Yeah. How you approach it, you need to be really transparent and clear and
Yeah.
firm about the issues that you found.
Right.
But the presentation has to be respectful of the fact that this may be the system they develop,
Right.
and there's a lot of emotion and territorialism that comes into
Sure.
those discussions. But yeah, for the most part, those are hard conversations for people to hear,
Yeah.
be engaged in, but they've been receptive,
Okay. So
to
the
making
right
the
culture,
change.
the right people, the collaborative approach,
Sure,
like really matters there.
sure.
Because you in some sense trying to like bring around a culture change, if you will, because it's not just tools, it's not just data, it's how people work and what they value is what you're trying to change,
That's exactly right.
right?
Yeah. Yeah.
And that takes time, I'm imagining. Or
Oh yeah, it takes time, and if you're gonna make process changes, if you're
mm-hmm.
gonna make culture changes, that's at the top,
Right,
top down.
right,
And a leader can't just say, "Oh, you guys handle it, fix our culture."
right, right.
It's got to really come from
Come
the
from
top
the
down.
top.
They've got to be receptive to that information, whether they've developed that data internally or consultants help them
Yeah,
identify it. Those kind of changes have to come from the top.
got it. I'm curious, right? Like, so let's say I'm going to just, if you're role playing, let's say I am a business operator. My business is in shambles. My CAC is through the roof right now. And I want to bring you on, but my concern is that it might just take a lot of time, and it's like a break in the process right now. So, are there ways in which you could sort of like make it such that it's not stopping your processes, it's sort of improving them, like sort of as you go, and they're
Well, every situation is different.
right,
And every provider that's called for my assistance, they're very unique.
yeah,
Everything's got to be pretty customized.
yeah,
But generally, their systems continue to march on the way they are.
yeah,
They have to just give me access to
mm,
the right people and the right information to
the
observe
right
and to
data,
gather in the right data, right? Before I can even make any recommendations. I mean, I
okay,
have to do a lot of,
yeah,
work, right?
yeah,
So no changes are made off the cuff. No changes are made without data,
right, right,
because I can't afford to go to my clients and say I have a hunch.
right,
My gut feeling tells
yeah,
me that you need to change this,
right,
right?
right,
Because I'm the one telling them you're relying on your gut too much, right?
right,
We need to be using actual data. So it's a really collaborative process, usually very, very eye opening
yeah,
for my partner companies that have hired me, and it's a fun process, but
mm.
it's one of uh, people have to be willing to hear information they may not want to hear.
Sure, sure. Do you see in these situations where like it seems like getting the data is sort of one of the hard, like the biggest challenges in like you starting to bring about that change? Because I'm imagining that everyone's playing for the same team there. Everyone's trying to like bring the organization forward, but unless you have the data to speak to it, It
Yes.
becomes,
For me, my initial phase of any consultative relationship is data collection, and
yeah,
it's me trying to get the data I need to try to decipher their business,
yeah,
their workflows, their efficiencies, and that doesn't have anything to do with personalities that are involved
yeah.
because those are separate issues.
Right, right.
In the culture that they've created that they're working in, separate issue.
Yeah.
For me, it's got to be data driven, and
Hmm.
it's just you can't cut corners on it.
Yeah,
You've got to really know what you're talking about.
yeah.
Yeah.
And it's like, is it like years worth of data? Is it months worth of data? Like what kind of volume?
Depends. It really
Yeah,
depends. Yeah, yeah. But you
yeah,
got to go back and get historical data. I mean, a
yeah.
snapshot today doesn't do
Right.
anybody any good.
Yeah.
Yeah.
So again, you don't want to build on recency in some sense. You want to look at patterns and
Sure.
bring out the
Absolutely.
insights.
Yeah.
All right. And so basically what you're saying is that things, even though the systems might have changed, things might have changed, the problems are sort of like gathering the data, being able to work in that fashion are kind of still the same. And that's something that,
I hear it all the time.
okay,
I hear it all the time. In my discussions with people too, it's a theme that comes up all the time.
okay,
And so yeah, it's very but the results of not having the data now, it's more pronounced
okay,
because it's a very fast-paced world.
right,
With the technology we have, and it's a dynamic industry, and there's
yeah,
rapid change.
right,
And if you're lagging behind
yeah,
in these kind of things, your competitors are going to pass you by.
got
Just
it.
period. And back in the day,
Yeah,
it might take years or decades for somebody to catch up and
right.
pass you, but not today.
Not
No,
today.
there's
That's
a
true.
lot happening out there. It was
Yeah,
fast.
yeah, things are changing so quickly.
Yeah.
And do you think the need for data and those decisions, it applies to the bigger organizations only, or is it as applicable, if not more, to the smaller establishments or people who are just starting out? How do you think about that?
Well, I think it's important for all levels.
Yeah,
Um, there are a lot of small providers
yeah,
that are remarkably small, and that they've kind of created a nice lifestyle for the founders,
yeah,
right, the owners, and that they never want to get big.
right.
They want to stay small, and I respect that. They
Yeah,
probably do fantastic work, and they can probably compartmentalize their data
right.
pretty easy.
Yeah,
But a lot of people find themselves even in those situations. I know people personally, right?
yeah,
And they start off with one house of 8 beds, and they
yeah,
filled it, and their life was good. And then
yeah,
they're like, gosh, we always have a waiting list. So
yeah,
let's do another house of
yeah,
8 beds. And and suddenly they've got
yeah,
three 8-bed house. Well,
yeah,
24 beds is a little different story.
yeah, yeah,
And it just can happen so fast. So now
right,
now you're already way behind on data. You're
right.
not collecting good information on inquiries coming in,
Yeah,
on your whatever referral contacts you're making out there, right?
yeah.
Not tracking it through the intake system. And so now you're playing catch up.
So data is the king.
It is absolutely, no matter what size organization.
Got it. Got it. Awesome. So let's change gears a bit, right? So you talked about when you were starting out a business, like the one thing that you had to constantly play catch up on was like how fast the industry is changing, like thinking about competitors, different levels of care, etc.
Mm-hmm.
What are some trends or like patterns that you see that people who they're starting out today, even operators in the business right now, should be thinking about as they think about systems, they think about processes?
Well, two things. One, what's really cool about our industry, and I
Yeah,
use the word industry, but
yeah,
behavioral health world,
yeah,
is that providers really are collaborative.
right.
They really, really are. We all mostly play really well together.
Yeah,
We
yeah, it's
cross refer.
complementary.
Yeah, yeah, yeah. We know we can't do it all
Right,
ourselves, and
right.
so there's a lot of cross referral, and
Yeah,
there's a lot of trust, and a lot of relationship building.
right.
I don't know. I haven't worked in other industries. I've been doing this my whole life,
Yeah,
but I can't imagine a whole lot of industries where your competitors are some of your
yeah.
best friends,
It is a unique
right?
setup,
It's
and the
very unique.
need is
Hmm.
only growing.
Right, right. That's a real cool thing about our world. Um, but I will say on the data side,
Hmm.
it, it's um, it's kind of surprising how quickly you can get behind the curve. I guess
Mm,
that's really my point.
right, right,
You might think you're a
right.
small company with 6 or 8, 10 beds, whatever it
Yeah,
is, and everybody, a lot of people are coming after your
yeah,
referral sources,
yeah,
right? I mean,
yeah,
it's like nobody has
yeah,
exclusivity out there. This is a
right.
very dynamic,
Yeah,
competitive marketplace, even if it's friendly and collaborative. It's
sure.
so
Yeah,
very competitive. And so I would just encourage the small providers to,
Yeah.
right? Look at starting early to
Yeah.
track your data, collect your data, analyze your data,
Yeah.
use AI as much as you can to understand
Yeah.
your workflows and your results,
Yeah.
and it'll pay off.
Yeah, and keep track of your relationships, keep track of like how the campaign's working. Even today, we just had a conversation where they were talking about, because you touched on like how quickly things can change. They're talking about they were running campaigns or they were running relationships with other referral sources, and they had to almost catch these things real time because everything has cost associated with it.
Mm-hmm.
So as soon as, let's say, a referral source drops off or an ad campaign, for example, stops to provide results, you want to stop then. So then having that link between an underperforming campaign has to be there and then. You
Absolutely.
can't lose time on that
Yes.
because
Yeah.
that's your bottom line that
Yeah.
gets affected.
Yeah. Yeah. I probably a lot of treatment programs people are nodding their head listening to you say
Yeah.
that and say, yeah, we experienced something
Yeah.
very similar.
Yeah.
Yeah.
Yeah. So we
Yeah.
keep hearing that. Awesome. We kind of getting to the last segment of the podcast. So here's where we, try to share some lessons. So one thing would be that, again, people who are like starting out today, uh, if was there something that you wish you knew when you started out? Again, probably a big list to choose from, but
All
if you,
right.
yeah,
Yeah. I will say this. Starting out today, my first comment is financial. Is you have to be well funded.
mm-hmm.
I don't care if it's family money, friend money, whatever it is. It's like whatever you think it's going to cost you to start your treatment program,
Yeah,
double it, triple it. You're doing it on a shoestring is very difficult.
right,
Say that first. Get that off the table.
sure, all right,
Other than that, trying to provide a culture where you're surrounding yourselves with really good, talented people,
hmm.
and let them do their jobs.
Mm-hmm.
My opinion, not
Yeah,
everybody's opinion.
yeah,
I don't like to micromanage, but I do like to surround myself with really talented people.
yeah,
And uh, but even with that, you run the risk of
yeah,
everybody trying to make decisions on their intuition and gut,
right,
right?
right. So
So
data,
exactly. So even with a high performing team, people you trust all
yeah,
around you, you still have to have the data, right? It's
right,
like you still have to be collecting it, analyzing it, and making decisions on it.
right,
And as a leader of a small business, a medium business, a large company, if you're making data-driven decisions,
mm-hmm.
those are going to set you up for more long-term success. And if you're making decisions based on your past experiences or relationships or a gut,
Mm-hmm.
what you think is best or your intuition, those are sometimes they're going to work out just fine.
Yeah,
But it's pretty dicey.
okay.
And once they go south, you can get passed by your competitors pretty quickly.
Right, right.
Yeah.
Is there an element of community too, to sort of like think about when you think about like operators and businesses?
Well, there's definitely a sense of community, but those are referral relationships that you've built over time
Mm-hmm.
that you can make a quick referral to,
Mm-hmm.
and they can make a quick referral back.
Mm-hmm.
And some processes or some businesses have much easier access points than
Yeah.
others. So although you might make a quick referral to get a
Yeah.
client who'd be better served somewhere,
Yeah.
they might hit their own kind of obstacles and brick walls going
Yeah.
in. And so you create those relationships in a sense of community where programs can make quick and easy referrals to each other,
Right.
share information quickly,
Yeah.
and really streamline that process of making a referral when it's not a good fit
Yeah.
is invaluable.
So like building strong long-term relationships, keep nurturing them.
Exactly. Right.
Yeah.
Yeah.
Yeah. All right. This is great. Thank you for having me.
Thank you for
Yeah.